Hello, everyone, and welcome to the Better Satellite World, the podcast of Space and Satellite Professionals International. I'm Lou Zaccarella. This podcast is brought to you through the generous support of Eutelsat, EchoStar Hughes, and Access Intelligence. Additional support comes from the 3,000 members of Space and Satellite Professionals International and its chapters around the world. Thank you, SSPI. In December, SSPI named its recipients of this year's Better Satellite World Awards. While our annual London event went virtual in 2020, it was still a smash with record viewership, the holiday feeling brought by our UK chapter, and most important, recognition of 3 extraordinary examples of how satellites help the world. Today, we're going to hear an interview with a representative of one of the recipients, Alan Kuresevic of SES Techcom. He represented SES's SATMED project, which received a Better Satellite World Award. He's interviewed here from London by Nick Swinburne, partner of Millbank Law. We hope you're enjoying this series of interviews with the industry's award recipients. Thanks again to Mansat and Millbank Law for their underwriting of our Better Satellite World Awards event. And now, Alan Kuresevic and Nick Swinburne talk about SES SATMED.
Alan, many congratulations on receiving this award. SATMED is such a brilliant example of technology and satellite being used in a practical way to make a real difference to people's lives. And I'm really pleased to have this opportunity to talk to you about it. I mean, for those who don't know too much about it, I mean, tell us what is SATMED?
Thank you very much, Nick, and appreciate to having me here. It's really always a pleasure for us to be selected for such a prestigious award in the industry. I think that's the honor to SES in the first place, but also a pleasure that we can contribute something to making the satellite the better world at the large. I think what SATMED is a kind of combination of the satellite communication technology and the suite of the e-health applications. It's a platform that is used by the NGOs, non-governmental organizations, mostly in the underdeveloping countries to provide the range of e-health services to the populations which normally would not have access to those services without SATMED. So as such, it's a kind of platform collaborated together with the different partners that is put at the disposal to the basically everyone who wants to deploy it in the area where the e-health applications or additional medical assistance through the communications applications would be required.
Great. And how did it come about?
Well, the SATMED is actually the follow-up project or product of the project we have in Luxembourg government called Emergency.lu. Emergency.lu is a system which actually, I must say, and proudly say that also got the Better Satellite World Award like a few years ago. It's a system that provides the connectivity for the first responders in the natural disaster cases. It's a worldwide standard, I must say, or de facto standard. And as a such system usually had a satellite capacity allocated to those cases of disaster response. We all know that disaster response don't happen every day. So there was actually some free capacity available at the time disasters are not there. So we were thinking like how we can use that in some better way and just being, let's say, hanging around idle. So we in the discussion with the Luxembourg government, who is a partner in this program, we realized that actually e-health applications are the next stage that can be, satellite connectivity can enable for the affected populations, not only at the time of disaster, but also at times in the kind of day-to-day work at the areas which don't have enough, let's say, health attendance otherwise using the other means. So the idea was to kind of complement the Emergency.lu system with the SATMED system for the day-to-day e-health service provision.
Okay, and how's it gone so far? I mean, where are you in terms of the sort of deployment of the program?
Well, the program is actually deployed since early 2014, so it's not something that exists since yesterday. It's well established. We started with picking up the good partners from the NGO sector. and looking with them together, developing the platform as such. And initially, we looked at the areas which are, let's say, in need for such services, which mainly areas affected in the Africa and Southeast Asia. So today we have a deployment in Guinea, Sierra Leone, Benin, Niger, Eritrea in Africa, and also in Southeast Asia, in Bangladesh and Philippines. So those deployments are all done in the good cooperation with the major NGOs like Archimed, Friendship, German Doctors, Cure, as well as Charity Clinic in Berlin, and our e-health partners, which are critical in actually making sure that we have a means and the support staff in the field that actually deploy and support those application systems once being used by the local doctors and local hospitals. We have served, proudly to say, tens of thousands of patients in different countries. What is very specific for SATMED is also the fact that it's a platform, so it's not a specific e-health application. It's a suite of 8 e-health applications, so every single case is a little bit different. So it's not that whole SATMED applications are used every time, but it's a selection of 2 or 3 for each particular case.
Wow, yeah, and I was very struck when I was sort of reading about SATMED that the amount of effort that has obviously gone into making that interface, you know, making the application itself usable, because as you say, you've got people with very different sort of levels of technical proficiency. You've got people in very different areas, different countries using it. And you know, I think it's quite something for a, you know, effectively a satellite company to take on not only the delivery of the satellite services and that, but also the development or you know, making sure that there was a bespoke application and interface for that. Was that a decision you made early on in the process? Did you feel it had to be a single solution?
Yeah, I think that's something which we felt it's very early in the process is a very important thing to do. I think when we started the project, or started the idea about the project, we realized there's many e-health applications that actually didn't flourish or didn't succeed well in the past. And we tried to look at the lessons learned for those and see how we can make that a little bit different and in the way that it's getting more acceptance in the field and better impact of what we are doing. So as such, we actually realized we're not going to take the part of creating the new e-health applications, because the number of e-health applications in the field, but select the major ones, the most used ones today, and put them in a single platform, connect them with some sort of software glue, if you want to call it, in the way that they can be used much easier than they can use individually. And also connect them with all possible communications and infrastructure, let's say facilities like local servers, cloud servers, and so on, and make this, let's say, technology behind completely invisible and transparent to the doctors and the users that are using it. Because that hurdle of technology was a kind of very worrying element in the beginning, which we managed to successfully overcome by let's say, packaging the SATMED both technology-wise and function-wise into the platform that is easy to use and easy to deploy in the field, and such obviously much more acceptable for the doctors and people with a less IT literacy to use for the daily work.
Yeah, no, very interesting. And in terms of, you know, that I mean, obviously medical information is very sensitive. You know, the confidentiality issues, security issues, and obviously people, you know, doctors and patients having confidence in that is critical. I mean, it must have been quite challenging looking at the sort of legal and compliance aspects of that and managing that. I mean, how did you go about that?
Yeah, that's actually an excellent question. It's probably like one of the scariest questions or challenges we had to do in this project. And we have also looked at this in the very early stages and discussed a lot with the governments, with the NGOs, with the UN World Health Organization to see actually what are the other people doing in the field. And we see that there are basically 2 different approaches. Actually, one predominant approach, which is the people are deploying e-health applications without really looking at taking care of the data protection and so on. And they basically come in with the idea, okay, like let's help first and then let's see what kind of, you know, remedies we have to take later and so on. Unfortunately, for SES, as being a reputable company, we couldn't take that approach, obviously, as well as involvement of Latvian government, let's say, asks for the much different approach, which we take from the early stages. So we look actually at designing the platform, making sure that the data which pass and using the platform are actually compliant to the Luxembourg national e-health and privacy protection regulations, thinking basically that it will be difficult to envisage that we're going to be compliant to every single country in the world, because we didn't actually know at the time when the system is going to be deployed. And also the other problem is that most of the other developing countries don't have actually any regulation in respect to the health. So you can actually not have something to kind of comply because it's not written. So we took the way to have a little bit like maybe high-end approach and say, okay, if we are compliant to the, let's say, health regulation of the European Western country, most likely will cover the case for the most of the other countries. And if not, we'll take the particular case especially. So that's all embedded in the system, saying that we clearly make a very good care of how we pass the patient data. There is also anonymization of the data in the system. When they pass from one user to another, they can decide to which extent they want to share the data. Also, one of the things that we had to address in the last year was also the GDPR restrictions and things related to the privacy protection in Europe. And that was also what we successfully handled and implemented in the platform as such.
Yeah, no, amazing. I mean, as a lawyer, I mean, sometimes regulation is a good thing for lawyers, right? Cynics would say, but and it's there for a good reason. But for things like this, it can, it must be a real challenge just to make sure you can actually do the good thing that you're trying to do without being hampered by all the regulation. I mean, lastly, Alan, to be honest, I could sort of talk about this all evening because it's so interesting. But I mean, for you, I mean, what's been, if you like, the unique, maybe the most rewarding or the unique part of this project for you, as somebody who works at a satellite company? I mean, what's really been for you the most unique thing?
Yeah, I think you mentioned it already before, Nick. I think the really unique thing here is that I think the first time that satellite company, or better say any other company, took such a vertical approach and integrated everything from the, let's say, basic communication elements to the e-health application elements in the one unique system, and actually took care of deployment, integration of all that elements across the chain. Obviously, we couldn't have done that alone, that's clear, because we don't have expertise and we don't have resources to do it. So partnering with Luxembourg government, partnering with the NGOs, partnering with the health experts from Charité University Hospital in Berlin, we're all essential in doing it. And I think that's something, I think, what makes SATMED unique in the sense that it's born from the cooperative work of the different actors which addresses the different parts of the system, and not as a single idea of one company who to move that forward and deploy. And as such, I think it ended up in being the system which is more likely to succeed and also more likely to scale, because what we're looking right now is moving from the actually NGO environment to the more national health infrastructure environments for the countries which would require such systems to be deployed for their national health infrastructures.
Yeah, well, that's amazing. Well, thank you so much, Alec, and congratulations on receiving this award to you, to SES, and to the SATMED team. And it really is a fantastic project, and I think is making as we say, a better satellite world. So thank you very much.
Thank you very much, Nick, and pleasure that we managed to get this award and the work we did for the world. Thank you.
That concludes the conversation with Alan Kuresevic, representing SES SATMED. Thanks again to Alan and Nick Swinburne for their conversation. It was great to be able to sit back and listen. The Better Satellite World podcast is brought to you by SSPI and its corporate partners, EchoStar Hughes, Eutelsat, and Access Intelligence, publishers of Via Satellite. Learn more about our sponsorship of the Better Satellite World series at sspi.org. Additional support comes from the more than 3,000 members of Space and Satellite Professionals International, and thank you again, SSPI. If you want to become a member, visit sspi.org. Student memberships are free. To learn how to use this conversation and its content free, go to bettersatelliteworld.com. Check out our Better Satellite World video series while you're there. And follow us on Twitter at SSPI, and check us out on LinkedIn and Facebook. A reminder, on March 22nd, SSPI will introduce a series of one-day forums with leaders in the industry on how they lead organizations through these disruptive times. Leadership in Turbulent Times will be followed on March 23rd with the industry's Hall of Fame induction celebration as new inductees enter the industry's Hall of Fame. To learn how you can be involved, contact Tamara Bond-Williams at SSPI. For Space and Satellite Professionals International and our producer Ana Gomez, I'm Lou Zaccarella. Let's make it a better satellite world.